If you are over 55 and playing pickleball, there's a good chance you've been told some wrong advice somewhere along the line. The goal of today's YouTube video is to go over some of the most common myths that I hear in a physical therapy clinic that may help somebody who's dealing with aches, pains, or injury on a pickleball court. The first myth that I'm going to go over is that rest is not always the answer to your pain. If you've been experiencing pain, there's something going on in the body that is trying to tell you something. And if all we do is rest it, it might take the edge off for a little while, but when it comes point in time to get back on a court, likely that thing that's telling you that you are experiencing something wrong has not changed at all. So instead of just resting while you have aches or pains or injury, we need to do something in order to build the capacity of the body in order to handle returning to the court. So just calming your symptoms down and putting a band-aid over it and not necessarily doing anything to try and improve your situation for when it comes time to play is not the best answer. So that is myth number one. Myth number two is that stretching is not always that answer either. So if we're dealing with some sort of tight muscle, whether that's my hamstring, whether that's my calf, or whether that's tightness in my shoulders, if I spend all my time stretching while I'm going through that period of time when I have aches, pains, or injury, I'm also not necessarily doing anything to change the capacity of that structure. So if it is my hamstring, my calf, or my shoulder, we need to incorporate some sort of strength exercise in order to build a tolerance for play. Myth number three is if you are not wearing Selkirk apparel while you're playing, you are doing something wrong. Actually, that is not a myth. Most comfortable apparel in the game, and obviously paddles speak for themselves. The third myth that I'm going to be chatting about today is that even if you're over the age of 55, it is not normal to be experiencing pain. Some people just think that as they get older, it's normal to have knee, hip, low back, shoulder pain, when reality is it's not. Whether that be a joint that's not being supported enough, whether that be too much time on a court prior to rest and recovery, whether that be actually something going on in that joint that needs a little bit extra attention with some targeted exercises, whether that's for mobility or that's for strength. So all in all, there's usually things folks can do to improve their situation or get out of pain. So to recap the three myths that I oftentimes see as a pickleball physical therapist, rest is not always the answer. That's number one. There's usually things that people can be doing instead of just resting. Stretching is not that answer either. And instead of just stretching a joint that's sore or around a sore joint, usually there's some sort of strength exercise that can improve the capacity of that area to handle returning to pickleball. And the third and final myth is that if you are over the age of 55, it is not normal to be experiencing pain all the time. So just because you have knee, hip, low back, or shoulder pain, there's usually things that people can be doing with it. And it's not just an excuse to say, hey, I'm old and I should be experiencing pain. So if you like this video or if you took any sort of information from it and you feel like it can impact your game, hit that like and subscribe button below. This allows me to reach more people. So I'd greatly appreciate it, and stay tuned for the next video coming out soon.